we are increasingly seeing the deployment of real-world data analysis, not just in ER-positive breast cancer, but across many different tumor types. And there are great strengths and important weaknesses to exploration of real-world data. Let me start first with the strengths. Real-world data typically allows us to look at much, much larger and more diverse patient populations than we could possibly see in a smaller, prospective, homogeneous clinical trial. The real-world data is also reflecting clinicians' patients in their own practice, right, across the country and sometimes across the world. So this is in many ways a much better reflection of what you're actually seeing every day in clinic than, for example, what you see in this confined, controlled, prospective, small clinical trial. Now, on the flip side, real-world data has some very important limitations. These are huge clinical genomic databases, often spanning into the thousands or tens of thousands. We don't have granular information on what happens with every single patient. For example, some patients might stop a medication because of progression. Other patients might stop a medication due to toxicity. Other patients might look like they stop a medication because they lost their insurance, or they got lost to follow-up, or they switched providers and went into another system. All of that is being pooled together in the mix. So when we look at real-world data, we can't measure a progression-free survival the way we do in a trial where we have a scan and then we look at the next scan. But we can measure something called time to next treatment, the start of one drug to the start of the next drug. We can measure overall survival. We can't get toxicity or safety data because, again, this isn't being prospectively rigorously collected for every single patient. With those limitations in mind, time to next treatment in many correlative studies has been shown to be a good sort of directional estimate of progression-free survival, even if the numbers don't overlap precisely.